Hello, Namaste. I welcome you all to the 44th session of Gurubodha. I am Dr. Janardhan Herbal. I cordially welcome all of you to this class. And on behalf of all of our students, I cordially welcome Dr. M. Gururaja sir, my Ayurveda teacher, to this class. Namaste, sir.
Namaste. Namaste to all.
So I dedicate this and all of my works at the holy feet of Dr. H. Chandrasekhar Gupta. This class is made live exclusively for Easy Ayurveda weekly class subscribers for free, and you can sign up at easyayurveda.com/video-classes. So we were discussing regarding the osteoporosis, and we just started with that in the last Gurubodha session. And we learned from Dr. Gururaja sir that it is mainly a Vata dosha problem affecting the Asthi dhatu or bone tissue. So whenever the Vata dosha increases, it leads to decrease of body tissues, generally all body tissues, but specifically the Asthi dhatu, right, sir?
Yeah, definitely.
With the passage of time, osteoporosis or bone erosion is also related with age, because with age passing, as we reach older age, usually after 40 to 45 to 15 women and 50 plus in men, the Vata dosha naturally increases, and it also starts, and osteoporosis also starts worsening. Guru sir, in your clinical practice, like what are the main symptoms that you often see with osteoporosis? Like how the patient complains, and when do you start thinking about osteoporosis and osteoarthritis as well?
See, straight away, usually nowadays it's not like that any patient will come and say that they have got asthik shaya or vata increases, something like that. They straight away come to an Ayurvedic doctor only when there is clear cut, there is a pain. And most of the times we try to evaluate these people only when they come for particularly the knee joint pain. Nowadays it's so common that knee joint pain, so many people are there. Those who are above 50, that is quite often we can expect and anticipate that that is very common to happen. But those who are nowadays in between 30 to 50 also, there are many people that are coming to the clinics in the name of pain in the joints. Then we evaluate them for these things, and there will be crepitus or the sounds, odd sounds in the joints while moving, as well as there will be some problem with calcium absorption, and even the vitamin D nowadays very rampantly. Every person, if you send to the laboratory, will come with insufficient or deficient vitamin D after post-COVID era. I don't know what is the reason for this. And this is the thing happening. And of course, people are reducing their activity, physical activities into the fields or into the playgrounds or something like that. Maybe that is another reason. And they are not exposing to the sun. And ultimately, age factor, not using their muscles, that also is causing the osteoporosis. And of course, age factor is one of the important one, leads to the decaying of the bone, and erosions are very common. And wherever there is a weight bearing joints, or wherever there is a pivotal point where the friction occurs, definitely when there is a reduction in the particularly kapha dosha in that area and increase of rukshata of vata, then definitely there will be frictions, and that friction leads to erosions, and as well even there will be just minute hairline fractures, or even porosity will be increased. So many such issues associated with decaying or decaying of the Asthi dhatu, and it is usually happens with increase of vata dosha. That's the way we come across these patients, and when we start an treatment protocol, which is against the vata doshas, reducing the rukshata of the body at the joints or the places where the pain is there, automatically the pain subsides and things are going to be normal. But many a times people will come with such a type of bow legs and all those things. There are already a lot of erosions are there, even ligaments and even tissues have become involved into that. And such type of cases, it is only managed to some extent. You cannot totally cure it. The condition you cannot be cured.
Yeah, one of the differentiating factors between rheumatoid arthritis or many other types of arthritis, even with gout, is that mainly the weight bearing joints, especially the neck sometimes, but lower back and the knee is largely involved. In case of osteoarthritis, in case of gout, we usually see that the greater toes are involved, and in rheumatoid arthritis, etc., the smaller joints are involved. So,
Generally, for osteoarthritis, we come across such type of pain and involvement of the joints, which are centrally placed in the body. First is it's cervical region, the neck region, the cervical spondylosis and all those type of things. Then comes lumbar region, then comes hip joints, then comes knee joints, then lastly ankle joint and heel. So many cases with typically no very particularly a case of calcaneal spur or heel spur, whatever you call it is also similar like of osteoarthritis, but at the point of weight bearing joint, and that is in the calcaneal bone. Similarly, it is in the ankle joint, then there is erosions, pain, swelling. Then it leads another one area in very commonly involved is knee joint, and of course that is one of the commonest and most painful condition. There are people with severe osteoarthritis and pain, swelling, and even there is sometimes restriction to the flexion motion of the joint, and that's why the counterpart suggests directly when there is a erosions and even the meniscus are involved, then they'll suggest to go for the total knee replacement therapy.
yeah, the suggestions to total knee replacement, and even in case of hip arthritis, etc., total hip replacement therapy is kind of very rampant. As far as I was seeing, if the patient is like not even able to like walk for 10 15 10 15 steps, or patient is like heavily debilitated due to arthritis, so much so that he is not able to perform daily activities. Only in severe cases I've seen that knee replacement surgery works, but for the rest of the cases it doesn't work as expected. So,
No, see, knee replacement therapy only helps in relieving you from the pain, because there were some the joints which are friction and under friction and which is causing a pain, that will be replaced, so there will be no pain. But your day-to-day activity and your movement will not be fast enough as earlier like that before the arthritis condition, and you can do all the work as usually. No, it is not possible. There will be some restrictions to that. You can just concentrate on that part. Only thing is where there is a severe bow leg formation or severe even meniscus involved, and it is don't like anything, and the space between the femur and the tibia is almost compressed, something like that. Then in such condition, we can suggest go for a total knee replacement. Otherwise, usually I ask the patients, those who come to me, that how long you can stand without pain at one place, and on walking for how many minutes or how much distance you could be able to do it without pain. Then are you able to climb the stairs and climb down the stairs? So these are the few areas which usually gives a very clear idea. And the other one is, the last one is, I ask them whether which type of commode you use, whether it is a Indian style or a Western commode, which one you are using it, and how far it is comfortable for the evacuation of bowels and all those things. These 4 5 areas very clearly they'll give suggestion and their opinion. Based on that, we start our treatment. Then these are the 4 areas which are important evaluation tools for us also in future. When course of treatment is going on, then we ask that now how far you can stand without pain. Then the pain without pain, the people could able to stand for a longer duration. That is the improvement is shown. Similarly, they could be able to climb the stairs and climb down the stairs without pain. They can walk for a longer duration or a longer time without pain. So such type of improvements could be understood. So this is the way we can manage the osteoarthritis conditions. But of course, if it is a severe bow leg and already too much of erosion is there, then option will be only the total knee replacement.
Yeah, and like you said, the toilet usage in India, like Indian or Western, is one of the advised points. Just to show the picture, like I mean, this is generally the on the right side there is osteoarthritis, there is wear and tear, and the ligaments and the meniscus and the whole of the joint is getting affected, and here this is shown as a healthy joint. So and also one of the important features of osteoarthritis is that because the bones are becoming weaker and they are getting degenerated, the gap between the upper bone and the lower bone, the femur and the tibia, this is a case of knee joint, reduces, and patient will be having difficulty in bending it. And usually there are two sorts of opinions regarding this. That usually if you go to like uh, MBBS doctors, they say that do not use Indian toilets, do not sit on the ground, and use only the Western toilets. And I mean, how we Indians traditionally take the meal, that has to be stopped. And some people say that keep on using it and start taking like oil massage, etc., so that the gap between the bones in knee joint increases and flexibility is retained. So, in which way do you go, sir?
Yeah, I don't ask my patient to restrict yourself from them. I suggest them very clearly, don't do any sort of activities related with the knee joint if it is a case of knee joint pain. That until unless there is a pain, don't do much of activities which involving the knee joint. If you are comfortable slowly, then use your joints, so that if you are using the joint, that will be retained, because it's a sharira very clearly. Shiryate iti shariram. If you don't use it also, it will be going on decaying. So if it is not to sit on the ground or not to flex your knees, and don't use Indian jailhouse toilets, use only Western diet, give rest to your bone. All these things are also not going to reduce any bone erosion or something like that, or osteoarthritis. It only just avoiding the pain to reduce it. But once we have a treatment protocol of reducing the vata and reducing the secretions inside the knee joint capsule, automatically the pain will reduce. So that's what we try to do it. And our intention of handling these type of osteoarthritis patients is very purely based on recouping the osteophytes wherever there is an erosion, to refill those things with some prithvi bhava. That is the thing what we usually do it. And we need to have the prithvi bhava, along with that something which can bind that to the place where it is required. That type of things which is having kashaya rasa, prithvi tattva, and particularly calcium type of things, or pravada, mukta, something like that, which can be used. Or even simple, we can use it for any sudha vargiya dravya. Along with that, lajjalu, or even arjuna, or even sometimes astishrunkala. So these type of drugs are very, very useful in binding the particular material to the place where it is required. So this will definitely help it to overcome the things. But once it is severely damaged, it may take some time. Many times patients are having some other multiple issues. They are not fit to be taken for total knee replacement therapies. Sometimes when we go for total knee replacement therapies, then they'll come to know that there is some problem in their valves, or aortic valve or something like that. Then some therapies will start, and some surgery may be shifted from knee to heart, something like that. It's happened in many of the cases. So all these things will be there. We need to understand that which are the areas and what are the type of patients whom can be handled as an Ayurvedic doctor or a physician. So in what way, how the panchakarmas or janu bastis or local things and even basti can help to what level. So definitely we can go for before treatment and after treatment, the MRI scans and other things, and of course a subjective feeling of improvement that can be noticed.
Thanks, sir. And there was an article saying that post-COVID, this arthritis is increasing and increasingly seen in younger generation. I mean, it was a common phenomenon after post 55, 60, but now even the 30s and 40s are getting it.
I don't know what is the reason. Maybe because they were not focused on these things before COVID. Now they're extensively focusing on these things. Or they want to just try to think. Post-COVID, Hashimoto's thyroiditis has increased. Post-COVID, thyroid syndromes and diseases have increased. Post-COVID, cardiac diseases increased. Post-COVID, arthritis has increased. Then what not has increased? Everything is increased after COVID. So now the entire blame is on COVID. They are putting it and they are coming out with. Maybe people are with awareness. They are going for more and more evaluation and more attending the clinics. So that may be one of the reason. So they are getting detected that they are having some problems. Possibly we cannot straight away simply correlate everything to the COVID, but this is the thing happening. People are telling that post-COVID this is increased, that is increased, and even cholesterol pattern has increased post-COVID. There is a clotting mechanism in the circulatory system has increased. Everything increased after COVID. Maybe because of COVID vaccination, or it is because of the disease itself. We don't know.
Yeah, and brain fade is another big this one. Someone asked, would you share the herbal medicines? We will come to the herbal medicine treatment part in a bit. In the classical case of osteoarthritis or osteoporosis, inflammatory signs are usually seen like warmth, increased warmth, or rubor, increased redness, etc., or just the pain is the main symptom.
So pain is the main symptoms as far as the patient is concerned, because that is very striking feature which drags the patient to the doctor. And on examination, there will be local rise of temperature, very you could be able to make it out. So I usually palpate the thing and joint, and just next to the joint places, temperature variation you could easily make out. So that is very, very clear in that. So in some of the patients, because of the friction and erosion, there will be increased flow of or secretion of synovial fluid. And knee capsule is in such a form it is designed, it won't even go out. So the capsule will bulge. And once the capsule of the knee bulges, anteriorly it is covered with patella, so it cannot push the patella forward much. So that's the reason we have in the popliteal fossa, there will be bulge we can feel, and that is due to the increased synovial fluid. So there may be even pain, there may be restriction to the movement, there will be increased warmth, sign of inflammation, then there is an increased secretion of synovial fluid. All these things will be there. In some cases, we can easily find out even the crepitus. There will be crackling noise on movement. So all these things are present in osteoarthritis, particularly of knee joint.
And if the patient is having, if the patient is of younger age, still should we be considering calcium supplementation in even in Ayurvedic terms, or just treating the inflammation itself would be sufficient, sir?
See, when we have certain tools, it is better to use them. If you could able to understand there is some issues with that, because many times the patient won't give you all the history related information and the way they live in 24 hours in a day, how they live really, what kind of activities they do it, and what sort of exercise they do it, and what sort of foods they are consuming. They don't give you all the details. For them it is not important one, and for them all these things are very much normal. Everything is fine. They are doing it right. So they don't give you any information from those parts. So what they'll straight away say is that there is something, pain is there, something is there. So whenever there is a striking feature, then only they'll come to us. That is one point. So we need to understand, if it is a young patient also, it is better to evaluate if anything, if you find suspect on movement, there is a crepitus and there is a swelling and there is inflammatory signs and patient complaining of pain. When all the parameters are showing things, better to evaluate even for the thyroid with issues, sometimes which is also connected to that parathyroid issues, then serum calcium, then all those things, and vitamin D, all these things should be evaluated.
Do you suggest, apart from lab investigation and X-rays, which are like common, even in the lab investigation also, apart from vitamin D, do you concentrate on any other things, sir?
See, very clearly, when I such patients of osteoarthritis, they come to me, I will suggest send them if they are not checked anything till now. I will suggest them to get evolved for serum calcium as well as vitamin D and a general routine CRP and ESR, something like this. All these parameters and even thyroid activity for DSH. So all these things I'll check it up once, and any issues in there, then accordingly it will be managed. If it is no such things are there, then we can straight away concentrate on the osteoarthritic part of it. And many a times the patients, the money is also a concern that we cannot send every patient to study the CT scan or MRI scan of the joints. Very clearly with simple x-rays also sometimes it can be understood that there is a reduction in the space between the tibia and femur that can also establish there is an osteoarthritic ring, and even the angling or the change of contour of the bone and everything will give you some idea that there is a osteoarthritis. Otherwise, simply we can send the patient even for the, if they are able to manage all these things, and if you want to have a clear picture, then send the patient for MRI scan as well as CT scan, whichever may be the suitable one. Thinking that which if it is a bony tissues involvement, better to go for a CT scan, and if it is a soft tissues, they are also involved, getting involved. If you feel like so, then you can suggest for MRI. And these things are there, then you can start with your medication as well as panchakarma like janubasti, bilateral janubasti with combination of oils. Then definitely with over a period of time like 2 months, 3 months, depending upon the type of erosion and the quantum of erosion, the things will settle down.
Yes, thank you, sir. And Pratibha, can you please go ahead?
Yeah, can you hear me now?
Yes.
Okay, thank you. So, sir, I brought my hand on because you asked the same question about the supplements. So it's always a debatable topic. Should we always have people on vitamin D supplements, like for people who live in like colder areas? But I've also seen vitamin deficiency in people from India and other southern continents where there is, most exposure to sun, but still there is no absorption of vitamin D. So again, it's not possible for everyone to have an abhyanga in the morning and get exposed to the very early morning sun rays. So what are your thoughts on vitamin D supplements, and why are there no vitamin D supplements in Ayurveda?
You see, when the natural sun is the one which is very much abundant in a country like India, probably our acharyas are not thought about this, something like supplementation, which can talk about these vitamin D and all those things. But presently, we are living in an entirely different thing, and our day-to-day activities are influenced by various factors which is taking place. Even the other side of the globe can also influence us, and we may also try to follow it. This is a very common thing which happens, and definitely when such things are there, I don't think so. We should abstain from ourselves from that. I don't want to use vitamin D like that. No, there is no harm in using vitamin D supplementation. We can use it depending upon the type of quantum of deficiency. We can use it for 2 to 4 months depending upon the condition, of course. And if in between, if it is required, you can go for one evaluation of vitamin D once again. But otherwise, doing abhyanga and exposing to sun is the best one. But it can be, if it is a marginally low, then it is better to use in that fashion. But many times what I have seen is that people will come with 9 ng per deciliter or 6 ng per deciliter, something like that, which is below 10, something like that. They come with the values. In those conditions, it requires to be increased in a rapid manner and in a very short duration. We cannot take it much time here. So that is, in those areas, it is better to go for directly supplements of vitamin D.
Great, thank you. A follow-up question to that: what do you think about sunscreens? And from an Ayurvedic perspective, what are your thoughts on sunscreens?
There are issues with the sunscreen also. All the sunscreens will not going to block all your ultraviolet radiations, but people with their genetic makeup accordingly, they will get very easily, because see, even the Westerners, how much they sleep in the sun, they don't get the brown skin as what we have in India. So that is typically it is our genetic makeup, and that is their genetic makeup which cannot be replaced. But as far as possible, exposing to the sun for a longer duration by a white skinned person on a longer period, it is not good. So that may end up in some ultraviolet radiation increased, and may lead to some other complications of skin cancer and something like that. And whereas in case of particularly the sunscreens protections, to some extent they are okay, but it should not be on a regular continuous basis, because that may also cause some problem in nature.
And uh, yeah, like I mean, why vitamins were not explained in Ayurveda is not. Uh, I would say it's not the right kind of question, because like Ayurveda was considering the nutrition. Ayurveda was seeing the nutrition through the prism of.
Let me stop here 1 minute.
Yeah.
See, if a question is asked like why vitamins are not explained in Ayurveda, yes, I accept it is not explained in Ayurveda. Then my question is, why the modern medicine has not explained about the Tridosha? Same
Yeah.
thing, because vitamins and something like that, this is their tool of explaining the things, bodily activities, and we have our own tools to explain the bodily activities. We use Panchamahabhuta and even Tridosha, Mala, Saptadhatu and all these things, and they use something different. Why that is not exact equivalent or not told in Ayurveda, it's very difficult to answer, because their parameters or understanding and tools are different from us.
Sorry, sir. I think the question was more like, why. So does it mean that there were no deficiencies of vitamin? Like, why are there more vitamin D deficiencies in the recent years? And I think you answered the question. It's all in the lifestyle and all. But do you agree that in those days there was not a concept of vitamin D deficiency and all in when we originally in like ancient times and all?
See, it's a very clear thing. In olden time, people used to walk a lot. They used their lot of muscles for day-to-day activities. Today, we are not doing so. We use a lot of vehicles for our movement. Second thing, even for the morning walk also, we go in a car till the park, and then inside the park we walk. This is our condition. So we have made ourselves in such a fashion that we are not using the muscles in that fashion. If muscles are regularly, properly used, definitely the muscles will help the calcium to retain in the body in a proper manner. So that's the reason, one of the important thing. Then there are a lot of issues with the chemicals we are using and the preservatives and many other things, and in a food packaging system, and so many issues, and something which is growing across the globe, whether it is suitable to us or not, we are eating it, and something which is from here we are giving to that side of the world, and even people are moving from this part of the world to another part of the world where entirely the atmospheric things and even everything is changed. So we are trying to accommodate ourselves in a new atmosphere and new type of locations. So all these things might have influenced our way of living, the things which are we are eating and we are consuming. So definitely they themselves create a lot of kavai gunya in the body and causes the deficiency status. So maybe those who are from the Western communities, consuming a good quality of nutrition may not be any issue for them. So there will be no issue with the nutrition. Whereas the people from the African and other these things, there will be a lot of issues with the Asia and Africa with the nutrition. So that depends on the type of food what they consume, the way they are been, they've been growing in places where it accommodates a lot many things, even the sunshine and even the work capacity and the using of muscles and everything. So there are multiple issues to understand this. Still, with that, one other thing is that you may have a sufficient quantity of vitamins in your body, but If you pour in also, your body, if that doesn't have any proper agni to imbibe it or digest it and imbibe it, then also there will be some issues. So we need to have a proper agni first to get the things into the system, and that is done, then definitely the things will change.
Sure, sir. Thank you.
And also, like, I mean, it was not like ancient Ayurvedic acharyas who are like not prescribing vitamin D. I mean, because it is, I mean, because they were giving Guru Ahara, Madhur Rasa Pradhana Aharasam, Brahmaniya Aharas, the vitamin D sources were covered in that. So it is very safe to say that, because if we go through the good sources of vitamin D apart from the sunlight is like fish, explained in Ayurveda, cereals, oysters, soy products, ham, dairy products, egg, mushroom, yogurt, cheese, orange juice, tomatoes, etc. So all these were explained in Ayurveda. So I mean, just because they are not using the term vitamin D, it doesn't mean that that part was not addressed, sir.
So definitely, their way of narration is something different, and we need to understand that when they are trying to reduce the vata in some other way, means they are also answering the vitamin D part of it in a subtle way. Maybe we don't know that what exactly the things they were supposed to is, because maybe Asthi Shrinkala itself is a very good source of managing the vitamin D. Asthi Shrinkala also has certain portion of it. So when you apply oil and take a sun bath and consume Asthi Shrinkala and these things, it will definitely improve your bone health.
So yeah, many different ways to tackle one problem. And just this question keeps on coming up, that can Ayurveda practitioner be using these supplements or not, vitamin D supplements or not, when there is evidence that there is classical decline in certain vitamin, as in case of arthritis, maybe vitamin D. If the lab reports shows that, then there is no harm in supplementing that. So
that is one part of it. When a statutory body is those who are responsible for giving licenses, they are providing licenses where Ayurvedic drugs are combined with vitamin D and available in the name of some brand names in market. So it is for the purpose of prescribing. So when this has been allowed to prescribe, then there is no harm in prescribing. If it is required, really required, then there is no, that's what I said. If it is, say, a patient comes to us with vitamin D deficiency of 6 ng or 4 ng, 8 ng per deciliter, then it is a very, very low. Then we need to do something which is, it takes up the things very fast. Then it is better to go for giving these materials directly, vitamin D directly to the system. That will help us. So in many times we keep on arguing on these things and even do a lot of chit chat on that. When the patient is having a less blood in him or hemoglobin level is low, then we think of giving Rakta Basti or something like that. It improves the things, and that is only one part of thing, and that's another modality of thing. But when it comes to my patient health, whether something which is to be done very urgently, then it is better to go with simply directly blood transfusion. Why you want to go with the Rakta Basti? That is my approach. If a patient is having very urgency, then he is approaching us at the last Kriya Kala, then we don't have time to do all these things. If he approaches in the second or third Kriya Kala, then we have sufficient time to manage these things. But when the patient nowadays approaches in either in Rakta Kala and Veda Kala, so in such type of things, we cannot go on just simply adhering to our principles of Ayurveda and we can do it. We are living in a 21st century and we are supposed to get covered under consumer protection laws. So we need to take a very clear understanding that whether if a person is really in need of these things in an emergency basis, let him take it. That should be given. So there should not be any delay in understanding it or even postponing it.
And also, I mean, one of the mistakes that patients make is that I clearly remember we were going to Shimoga Government Ayurveda government hospital, and there will be patients who come exclusively for getting us prescribed with a B complex and vitamin D, etc. Tablets. Like they are habituated and they think that taking it forever is good. And if I'm not wrong, there are many cases of vitamin D over supplementation and that causing many side effects also. So vitamin supplementation is good, but for a restricted period of time only, sir.
Yes, definitely. It is for the initially when it goes beyond 30 ng mark. Once that is the ideal one. So once it is come to that mark, then you can just slowly stop it. No need to continue it. It is not for a continuously to be taken. It is only for 1 week, 1 month to 2 months. Within that time, that the things will be reached.
Yeah. Karthikeya ji, can you please go ahead?
Sir, I just wanted to just share my little contribution that I am from Bombay, and I had a chat with my allopath about this whole vitamin D, and I was like, can I substitute from the sun? He said, Karthikeya, the problem is, I mean, this is a conversation that's about 5-6 years old. And he said the problem is that within this city and many other polluted cities, whether they are in India, anywhere in the world, the rays of the sun are completely filtered because of the thick pollution or the pollution layer, because of which he said people will be forced to take supplementation because just the rays of the sun as it used to be once upon a time, it will not work the way it used to work. This is my first contribution. I just wanted to share this with you. And the second is that there is another natural supplement that I am, it's being done by a few of my friends, where they are saying that a great source of natural vitamin D in terms of food can also be to take mushrooms, dry them up, and then make a bhaji out of it and eat it. So I just wanted to just share these two things with all of you. Thank you.
Thank you. And regarding like direct injury to joints, maybe sports injury or a road traffic accident injury versus the arthritis, will there be any change in the approach, sir?
See, initially when such things are there, there is a vranavat upacharet. If there is any vrana or something like that, then we need to do accordingly. Then if it is astigata vrana, if it is there, then accordingly treatment should be. And later, once it is stabilized, then we can go for same type of chikitsa where there is increasing the sthanika kapha dosha and reducing the vata dosha. That is the mainly concept in this that needs to be done.
Yes, sir. And one of the initial initial point to consider in case of treating sandhivata or osteoarthritis or osteoporosis where Asthi Kshaya is there is to improve the strength of Asthi Dhatu Agni. And we have discussed many times and you have guided us that, no matter how much calcium supplementation you do, if the Dhatu Agni is not good, it will not penetrate into the calcium will just circulate in the blood, causing many blood vessel issues, and the bones will not be the recipients of this calcium. So, so how to go about increasing the Asthi Dhatu Agni, sir?
It's by using more of muscles, of particularly the legs or calf muscles and thigh muscles and something like that. We can go for using them as a regular routine exercises, like something like isometric exercise. While sleeping, you can do certain cycling in the air or something like that. So such type of exercises will definitely improve the agni of the bones. And otherwise, Abhyanga is one of the important method to improve the vata in that particular area. And once vata moves in a proper direction and gets lubricated, automatically the srotases will get open and agni will definitely increase in that conditions.
And do you see the need of like a standard Dipana Pachana medicines which are also explained for vata dosha? For example, Hingvastaka Churna is told for vata dosha, and Shadharana Yoga of Sushruta is also told for vata dosha. So do you recommend starting the treatment with Dipana Pachana?
It's not simply because of Dipana Pachana. Many times people will have a good reason, but only thing is that Shadharana Yoga is going to be supporting in this condition. We can use Shadharana Yoga.
here, like, can we treat nutritional deficiencies by correcting agni in our body? If so, what kind of dravyas we should consume? So,
See, definitely. First thing is agni needs to be corrected. Once agni is corrected, that doesn't itself only correct everything. Then we need to give a proper supplementation. In then condition, when agni is proper and supplementation is given, then the supplementation is very easily absorbed to the system. So it doesn't mean that only by correcting the agni we can do everything. We need to correct the agni, then give a supplementation. Then supplementation will be absorbed.
Yeah. So I was just I texted you the message actually. I didn't want to disturb in between, but so suppose you just said that you have to correct the vata of the person first and then agni, right? But the person is kapha prakriti, and there is no sign of vata in the body. In that conditions, and they still have the knee joint pains and osteoarthritis situation. In that situation, what do we do?
See, whenever there is a patient complaining of pain in the joint, and itself is a sign of increased vata there locally.
Okay. Locally. Okay.
See, prakriti of a person is a total thing which has taken. It is from the entire body. It is not local anywhere, somewhere in the body. Because if we already learned that how the vata is dominant in particular part of the body, where pitta is dominant, where kapha is dominant, and what are their abodes. We have already discussed and we know that all those things. But doesn't mean that it's only present in those parts. Vata as an entity is present throughout the body. Kapha as an entity present throughout the body, but their concentration will be in a peculiar manner at particular places. That's what we need to understand. So when a patient of even kapha prakriti also with overweight, then also because of the obesity or even overweight, and even kapha prakriti person also can develop based on its age, his age, and certain issues, develop osteoarthritis. So osteoarthritis can happen in anybody, or any disease can happen in anybody. But those who are vata predominant persons, in them getting an osteoarthritis is very easy comparative to other persons, other prakriti persons. Point number one. Then whenever a patient of particularly of vata prakriti gets a vataja disorder, then his lakshanas will be very, very stronger. Where prakriti is something different and lakshanas are something different, then it will be easier to treat. That's what it is while explaining the lakshanas of Sukhasadhya Vyadhi, Kashtasadhya Vyadhi, Asadhya Vyadhi, and Yapya Vyadhi, all these things been explained. So we need to understand in that sense. If a person complains of pain and there is a crepitations in the knee joint, even though his prakriti is a kapha or pitta or whatever it is, locally vata has increased. Then your duty is to reduce the vata locally. That's what we need to do it.
Okay. Thank you, doctor.
apart from increasing the dhatu agni, which is the first thing, there are many herbal oils which are meant for oral intake, which is like Shirabala Taila, 101, etc. So which is kind of a very unique approach of Ayurveda, which differentiates from the modern, that snehana, internal snehana with daily snehana with low dose of Shirabala 101, Gandha Tailam, etc. is a very important piece of solving the osteoarthritis puzzle.
Definitely using of oil. That's what the basic. Another one important, maybe because of why we are getting a widespread of our very early stages or ages, we are getting osteoarthritis. Maybe because we are not consuming the sufficient sneha. Maybe in the name of cholesterol or something like that, or maybe with other issues, we are not taking sneha properly. So when even I have observed many female patients, when I suggest them to take Grita and Dugdha daily, they'll make lots out of faces. They won't ready to take the Dugdha and Grita. And when I ask, what is the problem? Why you don't want to take? Then they say there is a smell I cannot tolerate, something like that. So many issues are there with that. The female, and that's the reason. Many a times we come across female patients in a very early stages of osteoarthritis and osteoporosis and these type of things. Bone health decaying starts. So that is a very vital thing we need to understand. Sufficient Gritha Sevana should be done.
we are so exposed to this junk food and we eat restaurant foods where the oil is repeatedly same oil is repeatedly used for cooking many dishes, which again this one. So once we are habituated to that, even healthier oils will be having lesser effect because the agni is corrupted.
See, first of all, we need to understand that what is an oil? An oil is one, if you crush anything, oil should come out. Only those things are called oils. But presently we are using so many other things where a lot of process is involved to get the oil out of that ingredient. So such things are not treated as oil in Ayurveda. So that's why best one is tilataila. Consuming tilataila with regular intake and then consuming the coconut oil. These things are very good to the body. And of course, with cow ghee is the best sneha dravya, and that is definitely going to help us in every way. But consuming a lot of ghee and not doing any activity, simply sitting in AC, then definitely it is going to cause a wrong effect. We need to use our muscles sufficiently. We should walk and do all these things. Then only that will be good.
Sneha, oil and fat in diet should always be supplemented with something like Ushna activities such as exercise. We should sweat. Then only the muscles and the bones will be absorbing it. And related to ghee, I get this question a lot. That can we consume ghee daily to increase the snehatva even if we have high LDL or ghee's effect on cholesterol in general?
Definitely we can take it. If it is a pure cow ghee, there will be no harm. See, we are in a patient of high lipid profile. We are giving them lot of ghee in a Uttarottara Arohana Krama. Then we subject them for Virechana. Then we also assess them for lipid profile next month, like that. Then we have come across that it is going to reduce the condition. So don't worry, it won't increase the lipids, bad lipids or whatever the low lipids, LDL or VLDL inside the body. So we can definitely, but thing is that it should be pure ghee.
Usual Sneha medicines that are used should be on the screen. So Shirabala 101 is quite commonly used. Can you please take us through these different oils and their applications, sir?
I'm very afraid and I cannot make any comment. I feel Kshirabala 101 or Dhanvantram 101 is only just for the sake of telling it is 101. But I am afraid they have done the repetition of the process in manufacturing 101 times. It may be taken as something which is multiple times they have done it. It cannot be 101. Because when Kshirabala 101 is done, it becomes a highly thick paste. It won't be in the form of oil. So that's point number one. Second thing, in my practice, what I have observed is Kshirabala internal intake and Gandha Tailam internal intake, as well as Dhanvantram Taila internal intake. I have used in a many number of patients and they are convincingly good and they give good results. And regarding Mahanarayana Taila and Maharaja Prasarana Taila, I have not used, but I have used them in the form of some capsules from some companies. That can also be taken into consideration.
Probably Mahanarayana Taila oral intake, traditionally it is mentioned in the textbook. And Mahanarayana Dhanvantaram probably is useful when pain is more. So, and Gandha Taila is when...
If you want to take in that sense, then where there is a stabdata or kanjata or something like that, stiffness or restriction and something like that, then Maharaja Prasarani Taila and Dhanvantar Taila would be good. And wherever there is a pain, then Mahanarayana Taila would be good. Even to that external application, even Karpura Taila is good. But whenever you want to increase the bone tissue or bone mass and you want to take it internally, then in that condition, Kshirabala and Gandha Taila are good.
Sticking to the medicines for strengthening the bones, apart from the calcium supplements, you listed the Asthi Shinkrala and then Arjuna and Lajjalu. Lajjalu is the famous Kashmir North plant. Do you have any specific way of using it, or you just go with the supplements, sir?
So definitely when the Sudha Vargiya Dravyas are given Bhavana with Lajjalu, they becomes a good one. And even adding them Lajjalu in the form of powder into that capsules of amazation, that's also good. Asthi Shrinkala is one of the wonderful drug which can be used in the form of swarasa and used for trituration purposes, or you can directly dry them and make it powder. These two things are there. And Arjuna is one which helps in binding the calcium, and it also has a supporting the calcium channel in the body. Lakshadi Guguli is also one the same manner it functions. It improves the bone health by carrying the tissues, materials which is required to improve the bone tissue. So these are the important drugs. And to this, we can use Pravada Basma, we can use Mukta Basma, Pramukta Pisti, Pravada Pisti, and Sudha. We can use all these things, even Kapardika Basma, even Varatika Basma, Shankha Basma. So many things are there, it can be used.
Regarding osteoporosis in women, should we the strategy changes, or any extra herbs like shatavari or such things are added, or how to
I don't think so. I don't think so that any extra herbs are required to improve their reason. It's only a clear cut. Abhyanga is one important thing here for them. Then consuming milk daily basis is another important one which they skip. The people are interested to drink coffee and tea, but they don't take milk as it is. And it is better to consume these type of that is Asthi Shrinkala and such type of materials for the purpose of improving the bone health. And as such, they're very fond of these semi-precious stones and all those things. So for them, Pravada and Mukta would be good.
And Kartikeya, if you have, do you have any point, please?
Yes, sir. Sir, the question is that if a person is lactose intolerant, substituting milk, for what do you think of like 1 tablespoon of black sesame as a calcium substitute instead of milk? Because if a person is lactose intolerant,
you can do it in case of lactose intolerance. If you are very confirmed that the person is lactose intolerant, even to A2 cow milk or even something like that, then definitely you can go for improving your bone health by eating tila and guda in a combination.
Sir, why the combination with gur? I'm just curious, please.
It improves your palatability is one thing, and Guda contains naturally calcium as well as some portion of phosphorus in it, which is helpful for the bone mineralization.
And probably sesame oil and sesame seeds are sort of neglected. I have seen that in the explanation of Kavala and Gandusha, and also in many cases of like Danta Saushiria or dental caries, chewing of sesame seed is recommended. So that is also, teeth is also considered as part of bone tissue itself. So sesame seed and sesame oil usage is very important, externally internally also, sir.
Definitely, because we observe that Tilataila or sesame is one of the important ingredients to be used in case of hair fall. And people very clearly suggest that Amlaki Churna, Tila, and these things are combined with Guda and they are consumed to improve the hair growth. So hair is considered to be as Mala of Asthi. So it is in connection related to the Asthi. So it is in line. So that's the reason we use Tila in wherever conditions of hair as well as bone are involved.
If the patient is taking Calci 7, probably a calcium supplement. So Calci 7, palsineuron, and hystantin, if the patient is taking, what could be the best Anupana?
Hystantin is a tablet, palsineuron is a capsule, and once again Calci 7 is a tablet. And all these are proprietary medicines. The best Anupana would be water.
Probably, explanation regarding underlying condition, etc. would have
Still, if you want to give it in a case of anything, something like that, if Vata Roga or any nervine origin or even cerebrovascular accidents or something like that, in that case, if you want to give it with pulse urine, then you can go it with honey and make it, use it in a sublingual form. You can take it. That is also is there.
So for the pulsinoran capsule is like opened and the contents are.
The capsule can be opened and mixed with honey and taken as sublingual.
So sorry, I'm just missed this. In which condition usually it is prescribed in that manner, sir?
All these neurological conditions of Pakshagata and Ardhita and something like that, where you want to have the medicines reach so fast, then you can do, because it contains all bhasmas, and bhasmas can be very easily absorbed through the sublingual route. So that's the reason it can be given in that fashion also, by mixing it with honey.
So do you recommend for an Ayurveda doctor to prescribe that in case of like paralysis also? I mean, the patient is just paralytic and is coming in then, sir?
Definitely, even Brihatvata Chintamani, we recommend that Brihatvata Chintamani should be powdered or grounded, and it is mixed with honey and it is being given to sublingual route. It will be very easily and very fast to get absorbed, and it will even shows the results very early.
Yeah, and this question like warm or normal water, because the histatin is given, there could be underlying kapha origin skin condition, probably warm water will be better. So
Yes, when histatin is being prescribed means there is some allergy. To overcome that, that has been given, and there is naturally there is a kapha problem. And definitely when kapha is also involved and patient is need to go for some vata or chikitsa, then better one is ushna dravya. So you can go for any warm water is also good for it, because ushna will going to suppress both kapha and vata. Thank you all for your patience listening. Thank you.
thank you all. See you in the next Gurubodha session. Namaste.